Hello everyone, my name is Casey Pote. I'm currently in the RN to BSN program at Columbus State University. Today we will discuss national patient safety goals, and the one we will discuss is identifying patients correctly. Alright, let's get started. I work and do my clinicals in the emergency department, so I chose a national patient safety goal that correlates with the ER. This goal focuses on a common problem in healthcare and how to solve the problem. The goal we are discussing today says that we need to use at least 2 patient identifiers to identify patients. Examples of patient identifiers include name, medical record number, telephone number, or other person-specific identifier. This national patient safety goal is important because it is critical that you always have the right patient when providing care to that patient, so that no harm can come from the care provided. It makes sure that the patient gets the correct medicine and the correct treatment. Wrong patient errors can occur at any time during the patient's care, from the start to the finish. So you have to make sure that you're using the 2 identifiers throughout the whole care given, not just on the first patient contact. Patient outcomes will improve if this goal is followed, because it will reduce mistakes, which in turn reduces harm to patients. Now let's go over a case scenario that correlates with this national patient safety goal. There was a 28-year-old who was supposed to have an ambulatory surgery. She was very nervous for this surgery, and the nurse walks into the patient's room and picks up the chart that was laying next to her and in the patient's room. The nurse reads off the patient's name and the date of birth, and the patient acknowledges her, and so she proceeds to take the patient to the OR and get her situated on the OR table. The CRNA checks the patient's wristband and notices that it's the wrong patient. So they return the patient to the room, and luckily there was no harm to this patient. Now the patient was very nervous and wasn't paying attention to the nurse when she was reading the name and the date of birth on the chart that was apparently placed in the wrong room. This could have been prevented if the nurse would have just asked open-ended questions such as, what is your name and what is your date of birth? She also could have checked the wristband to make sure she had the right patient. Let's talk about a few research articles that back this national patient safety goal up. In this specific article, there was 813 wrong medication errors reported in Pennsylvania in a year's period. The author of this article states, a proper identification check not only consists of confirmation with the patient, but also requires confirmation with the MAR or patient chart, patient armband, patient-specific medication label, and or other record. That backs up the case study we discussed. You can't only rely on the patient. In the article, they found that only 12.9% of 813 patients were from inadequate identification check, where the caregiver failed to use the 2 identifiers that we discussed and didn't confirm it with the wristband. This is something that can be easily fixed if nurses would just slow down and take our time on everything. This next article we will talk about lists ways to prevent medication or misidentification. The list includes the creation and implementation of routine quality safety practices, continuous monitoring of reliable indicators, root cause analysis, the use of barcodes, phlebotomists not collecting blood from patients with wristband errors, education of healthcare professionals responsible for patient wristbands, interdisciplinary cooperation, addressing patient identification issues during orientation of new staff, and continuous monitoring. Like we keep talking about, patient wristbands seem to be the leading way to change this problem. Now this article is a little different than what we've been discussing, which is wristbands. It is about communication and readbacks. The overall result of this readback study says that respondents strongly felt that readbacks had an important role in patient handoffs. Patient orders regarding critical results, continuing and verifying surgical instruments, and delegating multiple perioperative tasks. Readbacks are an effective tool for reducing and or preventing adverse events in the care of surgical patients. Now let's do a recap. Mistakes can happen along the way anytime during patient care. The Joint Commission states the intent of this goal is twofold. First, to reliably identify the individual as the person for whom the service or treatment is intended, and second, to match the service of treatment to that individual. So let's all work together as nurses to reduce these identification errors by slowing down and double checking when we need to. Wristbands are the key. Thank you all for listening to my presentation today. I hope you enjoyed it and learned something new.